What is colectomy for Crohn's disease? Have you ever wondered what happens when medication just isn't enough to manage Crohn's disease? Let's talk about colectomy, a surgical option for those facing this challenge. Colectomy is a procedure that involves removing part or all of the colon, which is the large intestine. This surgery is often considered when other treatments fail to control symptoms or when complications arise. Crohn's disease is a type of inflammatory bowel disease that can cause inflammation anywhere along the digestive tract. It frequently affects the colon, and when the inflammation becomes severe, it can lead to strictures, bleeding, or even perforation. In such cases, surgery may be necessary to alleviate these issues. There are different types of colectomy, depending on how much of the colon is affected. A segmental colectomy removes only the diseased section while keeping as much healthy colon as possible. This option is suitable if Crohn's disease is limited to a small area. A right hemicolectomy takes out the first part of the colon, often including the appendix and a small portion of the small intestine. This is typically done when there is inflammation or blockage in that area. Then there is the subtotal colectomy, which involves removing most or all of the colon while leaving the rectum intact. After this surgery, an ileostomy may be created. This means an opening is made in the abdominal while for waste to exit into a bag. Finally, a total colectomy removes the entire colon and may also involve the rectum if it is affected. This type of surgery is more common in severe cases where the disease is widespread. It is important to note that colectomy is not a cure for Crohn's disease. The condition can still affect other parts of the digestive tract, and inflammation may return in remaining sections. However, this surgery can relieve symptoms, remove damaged tissue, and improve the quality of life when medical therapy is not enough. For individuals with a sensitive stomach, irritable bowel syndrome, or colitis, colectomy is a significant intervention. It is usually reserved for severe or complicated cases. The goal is to reduce ongoing inflammation and manage symptoms like pain, diarrhea, and bleeding. After surgery, many patients still have a functioning digestive system, but they may need to adjust their diet and lifestyle to adapt to changes in bowel habits. In emergency situations, such as severe colitis with a risk of perforation, colectomy may be performed urgently to prevent life-threatening complications. While surgery does carry risks, such as infection or bowel blockage, advances in surgical techniques have improved outcomes for many patients. Colectomy for Crohn's disease is a tailored approach aimed at managing symptoms and complications while preserving as much normal bowel function as possible. It is considered after careful evaluation and when other treatments have not provided sufficient relief.